Perhaps better than most Ontarians, the province's frontline workers understand our healthcare system and how it's worked and how it's fared since the Liberals took power in 2003. Here now to tell us what they've seen over the decade, Michelle Acorn. She's a nurse practitioner who works at Lake Ridge Health in Whitby. Bob McWhirter, he's a community care coordinator in downtown Toronto. And Kamini Kalia, she is an advanced practice nurse at the Centre for Addiction and Mental Health. And we're happy to have you three around our table here this evening on TVO. I want to remind everybody watching that our producers, Sandra Jonas and Daniel Kitts, are hosting a live chat right now, so chime in with your thoughts at theagenda.tvo.org or via Twitter. Use the hashtag AgendaTVO. Michelle, to you first. Your job over the past 10 years, how's it changed?
There's significant improvements, more in terms of enabling and empowering. So with legislation and regulation changes, for example, we're able to broadly prescribe broadly ordered diagnostic tests and laboratory tests, for example. We're now able to admit, treat, and discharge patients in hospitals as well as long-term care. There's 2,300 nurse practitioners now.
And growing.
As well. Growing. 70% are in Ontario. So Ontario is certainly leading the way.
So you are pleased at the way things have changed?
Definitely.
Okay. Bob, how about to you?
I would say 18 years ago when I started this job, if a client called to say that they were not feeling well and could not reach their GP, we would suggest that they go to the hospital. Today, we are doing everything possible in partnership with the hospitals to keep those individuals out of the hospitals. So working as well with the family health teams in the community and ensuring that they get the necessary supports where appropriate at home.
And you're trying like heck to keep people out of hospitals because?
It costs money.
More expensive to treat in hospital.
Absolutely.
If they don't need to be treated there, let's not do it.
Absolutely.
Okay. Kamini, how about you?
So what I'd like to speak to is actually the population trends that I'm noticing. So we're seeing an increased complexity with the clients that we serve. So for example, not just the mental illness, but also comorbidities, meaning also medical conditions like cardiovascular issues like heart disease or diabetes and cancer. So in addition to that, I'm also seeing an increase of individuals coming to our emergency services. And that might have to do with anti-stigma campaigns that, for example, CAMH has been doing. But certainly there's a demand for healthcare services, whether or not it's for our emerge and inpatients, so the hospitals to serve, is a question, or whether or not there needs to be further investment in our community-based services.
I know none of the three of you is a politician running for office, at least to the best of my knowledge. Having said that, we're in the middle of an election campaign right now, and since you people have the experience on the front lines of healthcare, people watching us may want to know, do you think you've done well? Kamini, to you first. Have you done well with the provincial Liberals in power?
So one of my reflections, I guess, in this question would be the emphasis on mental health. So certainly there's the Ontario Comprehensive Mental Health and Addiction Strategy that's come out, where there's an emphasis on our youth, for example, in the first few years. So we do know that youth suicides continue to be high, and so having an emphasis on our future is very important. In addition to that, looking at prevention, so early detection and intervention has also been a very important stressor.
And they have been attentive to that or not?
Absolutely, in this strategy, absolutely.
Okay, Bob, how about to you?
We, without supporting any particular party, we definitely appreciate the increased support in keeping individuals at home and allowing us the resources to ensure that individuals have access to a whole variety of healthcare professionals.
Michelle?
We're definitely pleased with the movement. We have 26 nurse practitioner-led clinics in Ontario. We have a growing number of nurse practitioners in 3 specialties, primary healthcare, adult, pediatric, and a 4th graduating in anesthesia as well. As I mentioned, admit, treat, and discharge from hospitals. We're practicing in family health teams, community health centers, MP-led clinics, hospitals, and long-term care as well. And we're able to improve care, and they can be registered to us as their primary health care provider as well.
Bob, what is the thing that you have gone to the province for, not you personally, but for example, people who do the kind of work you do or the organization you work with, you've wanted to get this through, but you haven't been able to yet?
I would say probably increased funding to try to transition more people out of hospital and get them into the home. That's one of our key foci in terms of getting those individuals that really don't need to be in hospital. Being in hospital longer than you need to be is just not healthy.
Right. But you've made that case.
Yes.
Hasn't happened as quickly as you've wanted?
It's happening. It definitely is happening. It could happen faster.
Okay. Kamini, how about you?
I'd like to see a continued emphasis for any government that comes forward on our community-based services. So when I think of community-based services, it goes beyond just having a worker, but also having attention to our social determinants of health. So access to affordable and safe housing, employment, ensuring that there's stable employment opportunities, and looking at income as well. So we know that those social factors will improve the overall well-being of all Ontarians.
How has the Ontario Liberal government done with that so far?
Again, so there's been attention to integration and looking at a shift from mental illness, for example, to mental health. And so increased dialogues with, again, with the, as I mentioned, the strategy with a focus on creating vibrant communities.
Okay. Michelle, anything that you really wanted on your wish list that hasn't come through? I know that all three of you here, we've got the Minister of Health coming on in a few minutes, and you might be a little nervous about saying anything that's going to tick her off, so I get that. But anything that was on the wish list that hasn't come through yet?
I think that the minister doesn't know that I've actually directly dialogued with as well, but the remaining Bill 179 that improves access to care is vital. So point of care testing for nurse practitioners, removing of diagnostic limitations, CAT scan, MRIs, for example, is really important. Referrals to specialists so that there's no disincentive. So if a nurse practitioner refers the same as a physician, the specialist would actually accept those referrals on a more timely basis to improve efficiencies. The Highway Traffic Act, for example, for fitness to drive, exceptional access programs that we're still not able to access as nurse practitioners to help patients get their drugs and treatments.
Now you have just let me jump in for a second, because clearly you want nurse practitioners to be able to do more things.
Definitely.
The Ontario Medical Association, which represents doctors, isn't necessarily on the same page, because you might be taking money out of their pocket, right? So it's up to the minister to sort of juggle those competing interests. How well has she done at that?
I think that she's done well. I think with the Health Human Resource Strategy to ensure that we're all maximizing our scope of practice, realizing it's not a competition, it's interprofessional, there's a lot of work to be done, and that we can actually capitalize on role and scope overlap, but also how do we improve and put the patients first. It's actually not about a turf war. It's actually about how do we change the paradigm of healthcare? How do we transform it and deliver safe care as well?
I know everybody says it's not about a turf war, but at the end of the day, it's you get to do this and you get to do that, and you don't get to do this and you don't get to do that. So it is kind of, isn't it?
It can be as well, but I think sometimes we focus too much on the providers, and actually we need to focus on the patients as well and realize it's the right time for the right reason, the right place, and the right provider as well. And sometimes right now with the election on the forefront, I think we need to realize why we're here, and that's to improve the health and access for Ontarians. And how do we actually help that government do their job? And we have a great track record doing that as well.
Bob, do you have any concerns about another party coming to power as it relates to what you do?
Well, there has been some talk of other options. I guess at the end of the day, you know, on the ground, working on the front line, you know, my colleagues and I, basically, our major concern is just making sure our patients, our clients get the care that they need at the right time and the right place. So, you know, election time, there's a lot of talk. And if you grab onto every piece of information that you hear from a politician during election time, you're just going to go in circles. So part of my job is to reassure my clients that we're going to continue to provide good care to them, and they're going to get the care that they need. Is
there one set of promises you've heard so far that you have thought, that's taken us in the wrong direction, don't like that?
Well, I certainly, I've heard some things with regards to one of the parties with regards to community care access centers, and I firmly believe that CCACs or community care access centers, you know, our specialty is case management. So we're the individuals that the client will call when they have something that, you know, they need some food in their home, or the nurse hasn't showed up, or they don't know how to negotiate the system to get into a long-term care facility, or the caregiver whose husband is wandering the streets and she has no idea what's going on. So it's these kind of people that we need to be there for.
Gotcha. Okay, I want to thank the three of you for coming in tonight and setting the table, because we have the minister and lots of critics to come. Thanks for showing up tonight, folks. Michelle Acorn, the hospital nurse practitioner, Bob McWhirter, community care coordinator, and Kamini Kalia, mental health nurse. Good of all of you to come into TVO tonight.
Thank you.
Thank you,
Up
Steve.
next, from the front lines to the political lines, the Minister of Health and her critics right here, right after this. Okay, frontline workers gave us their view on how the healthcare system was functioning, and now joining us for their perspectives, we welcome, in London, Ontario, Deb Matthews, Liberal candidate for London North Centre and Ontario's current Minister of Health and Long-Term Care. Here in studio, Christine Elliott, PC candidate for Whitby-Oshawa and her party's health critic. In Sudbury, Ontario, Fran Janina, NDP candidate for Nickel Belt and her party's health critic. And again, back here in Toronto, Teresa Punn. She is the Green Party candidate for the riding of Willowdale and an allergist and immunologist practicing in the GTA. And finally, Ashley Chanati, reporter with QP Briefing. And we are grateful to have you three around our table and our two guests out of town around our virtual table joining us for this discussion. And I know just before we get started, speaking on behalf of certainly everybody who's on the program today, and Christine Elliott, this is your first visit to our program since your husband, Jim Flaherty, so unexpectedly passed away. We wanted to pass along our condolences, I know, on behalf of everybody on the program and so many of our viewers as well.
Thank you very much, Steve.
And now on to business. Minister, to you first. Why do you think the public has been well served having a Liberal government in power for the past 10 years as it relates to health care in the province?
Well, Steve, I was elected 10 and a half years ago, so I remember very, very vividly the stories I heard from people in my riding about the healthcare system then. It was impossible to get a family doctor. Now we've got almost all Ontarians with a family doctor, and we're really focusing on those areas where it's still a challenge. People were waiting unbelievable periods of time for important surgery. We've cut wait times in half, and people notice that. We've rebuilt our infrastructure. We've had a real focus on mental health, and I think one of the biggest shifts we've seen over the last few years is a lot more support at home and in the community, and that's, again, something we want to continue to build on. I like to say that our system is not perfect. It's a whole lot better than it was 10 years ago, and we are going to continue to work to make sure that people do get the care they need when they need it in the most appropriate place, and that's very often at home.
Okay, you may not be shocked to hear this, but I'm not sure your critics are all going to agree with that assessment. Let's hear what they have to say here. Christine Elliott, the Liberals think they have a good story to tell on family docs, on wait times, on rebuilding infrastructure, etc. Do they?
No, I think there's still very many major gaps in the system, and study after study has shown that while we are spending a lot of money on healthcare, we're not getting the best value for each dollar spent. So we really need to redouble our efforts in that respect, because we're seeing more and more people who have special needs, more and more people who need access to life-saving medications that are very expensive. We have more and more people who are not getting the home care services that they need and who are waiting in hospital for long-term care services. We still need significant more mental health and addiction services. We've concentrated, to be fair, on youth and early identification, but we still need to have more robust services for adults and places for care for young people.
Franjanina, how do you see it?
Well, I agree that there's been a phenomenal amount of money invested in our healthcare system, and some of that money has brought us good programs and services. But if you look at it in its entirety, the Ministry of Health is there as an overseer. I would say they have failed in their primary mandate of oversight and accountability, which means that for the $50 billion that we spend, a lot of it ended up being spent in ways that did not reach the patients. So every Monday morning when we go to the office, we have an hour complaints of people who did not get their PSW service, who did not get their home care, whose loved one with a mental health crisis ended up in jail or ended up in anywhere but where they should have been looked after. We have a good home healthcare system, but we could have done so much better with a better overseer, a better Ministry of Health, a better Minister of Health that would have done their job better.
A better Minister of Health as well, is that what you're saying?
Yes, I am.
Okay. To the Greens, what do you say?
So as a physician who's trained in 3 provinces, I understand that over time, yes, we have come a long way. The problem is if that's all we're doing, we are going to fail our population in the future. The needs will only increase. The obesity epidemic, the elderly epidemic. Our patients are currently not being served well enough today, and we have to prepare for the future.
What's missing that hasn't been happening for the last decade that you think ought to be?
So something very unsexy, and I don't know if it would ever grab headlines, but we need a lot more nursing home beds. So right now, many patients in the hospital are there for far longer than they need to be. As an example, when I was doing internal medicine, sometimes as high as 80% of my list of 30 plus patients were what we deemed inactive or alternate level of care, meaning we fix them, but they have nowhere to go.
So they stay in hospital.
Exactly. Sometimes it's not safe for them to go home, even with all the home care supports we can throw at them. Sometimes they do need a transition space where they can receive the rehab they need. And so a bed in the hospital costs upwards of $1,000 a day. A bed in a well-trained retirement home that is safe and that is respectful to our elderly would cost far less and would provide the elderly with the time to convalesce.
Okay, lots of issues to get into there. Ashley, you watch this obviously from your nonpartisan perch at QP Briefing. Liberals think they have a good story to tell on healthcare. What does it look like from where you're sitting?
I think it's a very mixed story. I think there are a lot of successes that this government can tout in the healthcare system. I think that there's been a lot of hospital infrastructure renewal. I think a lot of communities can say that they've seen, new builds or renovations in their areas. I think that a lot of the shift towards community-based care is the right spirit, and I think it's something that all parties have in their platforms in varying degrees and in varying ways. And I think that's something that is necessary as we face the demographic challenges we do with the aging baby boomer population. But I do think that there are glitches, and very high profile and expensive glitches. The Orange Air Ambulance scandal, the problems at eHealth and trying to get electronic medical records. We've come a long way since that happened a few years ago, but you still see study after international study that says Canada and Ontario lag the rest of a lot of developed nations with strong healthcare systems when it comes to our electronic medical records. And now there are questions whether straight up electronic medical records are enough, or if they need to be this new, more integrated version we're seeing in other countries, particularly Scandinavia.
Deb Matthews, I do want to give you an opportunity to speak to what I know you have spoken to so many times over the years. And you are, I think, now by record, the 3rd longest serving health minister in Ontario history. So you have been at this for a while. What do you say to Ontarians who, when they think of the Liberal record on health, they don't think of the family doctor situation, they don't think of the wait times, they don't think of the rebuilt infrastructure, but rather they think about 8 people who died who maybe didn't have to die because the Orange Air Ambulance service wasn't there for them when it should have been?
Well, first of all, that's a misinterpretation of the report on Orange Air Ambulance. What we do know is that Orange provides life-saving service every day. I met just last week a couple of premature twin babies who were airlifted from Walkerton to London and owe their life, in all likelihood, to Orange. So those people at Orange are doing a very good job. It's true, there was a problem at Orange, and when I became aware of it, all of the people, the senior leadership, including the board, were fired, so they are no longer there. It's a big, Ministry of Health is a $50 billion enterprise. Occasionally there will be problems. That was a problem, we fixed it, but patients get excellent care from Orange. So I never shy away from fixing a problem when we find it, and that's what happened at Orange. When it comes to eHealth, we are now so much further ahead than we are. We're about 70% now of family doctors are using EMRs, and we are building that integrated approach so that information can be shared, whether it's through Connecting GTA or CSWO in southwestern Ontario. We're getting now hospitals being able to exchange information, diagnostic reports coming back from labs and from other diagnostic tests that are done. We're connecting to family practice, primary care, community health centers. It is all coming together very, very well. And Ontario has gone from being the worst to being the best when it comes to eHealth, and I'm proud of that improvement. It is foundational to the success of our healthcare system. We have to embrace that new technology so that we can get the best value for our healthcare dollars and patients get the best possible care no matter where they go for service.
Okay, let's see what Christine Elliott has to say about that record. What do you think?
Well, I think, first of all, with respect to the Orange situation, there was a clear indication that the minister and the ministry were aware of problems with Orange several years before action was finally taken. That was raised both by the third party and by us as official opposition. So it was really only when the investigative report came out that action was finally taken, and some would say that was too little too late. With respect to eHealth, I would certainly agree that it is completely necessary in order to transform our healthcare system, both to make sure that we can prevent toxic drug interactions, that we can prevent people from having to repeat their story time after time to healthcare professionals. But I think more importantly, if you really want your system to function efficiently and you want to bring all healthcare professionals up to their full scope of practice, you need to have a way for them to communicate effectively with each other for the benefit of the patient.
Are we there yet?
That's not nearly happening, and I think you can only point to home care where they're still reliant on phone calls and faxes, if you can believe it, in home care. So there's a lot of work that needs to be done, and for the life of me, I still don't understand where we are with it, where we should continue on the path that we're going because we don't seem to be getting anywhere, or whether we should scrap it and build on a new system. I would really like to know the answer to that. That would be a first priority for us.
Francherina?
Well, when I hear the ministers say that the minute I became aware of what went on at Orange, I acted, I can't help but laugh. I mean, we had a series of 30-some questions on Orange back in 2009, which those were estimate questions, which they never answered till 2012 after the story broke. In January of 2011, Alfred Apps, the president of the National Liberal Associations, with all of the board and bureaucracy of Orange, went to the Minister of Health, to the ADM, to the DM, to the Minister of Finance, and presented this incredible corporate structure that made no sense. The lawyers, the bureaucrats that listened to this told the Minister of Health, told the Minister of Finance, and everybody else, this makes no sense. But they let it go, and they continue to let it go. And then Maza and Belsner and everybody else that was there drove our ambulance system into the ground. I live in Northern Ontario. The people I represent depend on that ambulance system, and it failed us and it let us down. And to rebuild it from its ashes is extremely difficult because they let this go for so long. This is my opening comment, that we need them to focus on their primary mandate of oversight and accountability, and they failed us. Then we go into this culture of entitlement, that it was okay for Dr. Maza to be paid $1.4 million and for Belsner and for Mr. Apps and all of those people to rake in the big money. And you see the same thing when you look at eHealth. The Auditor General put the $1 billion scandal forward for eHealth, and basically the Liberal government used this money for eHealth as a slush fund for well-connected Liberal insiders.
Okay, let me chime in here if I could for a second. Let me chime in for a second because I do need to ask the follow-up question. Much of what you're describing, if I understand it properly, happened on the watch of previous ministers of health. The story the Liberals are telling is that Deb Matthews got in there and cleaned it up. Is that not the case?
No, she was the one that sat in at during estimate for Orange. She was the one who was there in January of 2011 to listen to the briefing from the people from Orange that was telling them we are about to embark into a corporate change.
Okay, I understand. I don't want to, we're not going to let the whole hour be spent on Orange because there are other things to talk about. But Deb Matthews, let me give you a response on this, and then I want to move on.
Yeah, I just can't help but be struck by the contrast between what those frontline nurses had to say about how things were significantly better than they used to be, and then hearing the politicians say how horrible things are. I actually have a confidence in the experience of those frontline workers. They see what's happening, they know what's happening, and they are seeing improvement. And I'm pretty proud of the improvement we've been able to make. There's more to do, absolutely, but we've made significant progress and have really built the foundation of our healthcare system. We inherited a system that was in very bad shape. Lots of talk about two-tier healthcare. We now have demonstrated that we can have a publicly funded system that works for patients. And we're going to continue down that path. It's the right way to go.
Teresa Pun wants a word on this.
Yes, so I can speak as both a politician and a primary frontline worker. So the reason why eHealth integration is so difficult and so costly is because when we decided to integrate, a lot of people already had it. So when I was as a medical student on University Row, the eHealth system is different at the hospitals across the street from one another and beside one on the same street. This is in stark contrast to Newfoundland and Labrador, where I completed my internal medicine training for residency, where I think at some point in the 80s, they all got together and said, we should have eHealth. They picked one system, Meditech, just one provider, and they flooded the province with it. So in Newfoundland, I'm able to get cardiac catheterization reports, cardiac ultrasounds, echoes from the 80s.
Because everybody's speaking the same language.
Everyone is on the same system. So right now, that's why it's taking so long to integrate our eHealth system. It's a very important step to take, but it will take time and will take money because everyone already has their own provider and you're paying all these fees, and to integrate or to upload onto a new database, that is very time consuming. And the last thing we want is for those systems to shut down.
Okay, let me move on to community care access centers, which has been a bit of an issue for the government as well. Earlier this year, Bob Hepburn of the Toronto Star laid this out in a column in the newspaper, highlighting the fact that substantial CCAC executive salary increases took place over a 3-year period from 2009 to 11. He pointed out the use of public funds to pay for lobbying firms, which didn't sound too kosher, and then only to 40 to 50% of the funding actually going to frontline care providers. And he asked some pretty tough questions about whether or not the government was adequately on top of the CCACs. Ashley, let me give you the first word on this one here. This did percolate up into a bit of a story at Queen's Park. How has the government handled it?
I think that the government has had an interesting approach to the CCACs. There have been a lot of questions about them and whether or not it would be better to integrate them into the LHINs, the local health integration networks that are generally the funders. They don't seem to be going in that direction. They seem to have doubled down on the idea of community care access centers through this program of Health Links, which is coordinated care. And it's my understanding that the CCACs are very heavily involved in how that's administered.
Let's just stop for a second, Ashley.
Yeah.
This is significant plumbing we're talking about
Okay.
here. The LHINs at the top of the food chart, right? Local health integration networks, which rationalize the resources and say who's going to get what and all that. The community care access centers, which are the sort of closer to the ground folks who you go to get your services from them.
Precisely.
And then Health Links are
a program run by the community care access centers that seek to target those most acute patients and coordinate their care between their general practitioner, perhaps their specialist at a hospital, their personal support worker who comes in for home care, their physiotherapist, and that's usually a nurse at a CCAC who oversees that client file to help coordinate it.
Just to clarify, Ashley, the CCACs don't run Health Links. Health Links are collaboratives where everybody comes together, a table of equals, and it's showing extraordinary success. I'd love to talk about more about that, but we'll come back to that later.
No, while you have the floor then, why don't you speak to Bob Hepburn's issue, which is his view is there's way too much administration and not enough money into frontline services, and that's as a result of, in his view, plans that the Liberal Party has put in that he doesn't think works. What's your view?
So it's very important to me, no matter what part of the healthcare system that we're talking about, that we get the best possible care for patients and the best possible value for money. So a few weeks ago, I actually convened a group of people as a working group to give advice on is there a way to get better value for the money that we're investing in home care? Can we streamline that process at all? And when I spoke to various people about doing this, everybody's got very good ideas on how we can streamline that system more. The reality is, we've doubled funding for home care over the past decade. We've doubled the number of people who are getting care through the CCACs. We believe that home care is now an equal pillar to primary care, to hospitals. It's a truly very important part of our integrated healthcare system.
But have you doubled the size of bureaucracy as well?
No, you see, the question is a case manager, where do you put them in the delivering care category, or do you put them in administration? But I can tell you, case managers are a very important part of the work that CCACs do. They understand the needs of the individuals, and they put together the care plan. So to sort of characterize them as some sort of bureaucrats who don't add any value is just wrong. CCACs spend a very small percentage of their overall budget on the true administrative costs like rent and paying for executives and so on. But is there a way to deliver home care where we get better value for that money, where we can get more care to the front line? There are things we can do, and we will be doing those.
I think we have some ideas from the critics right now. Christine Elliott.
Yes. Well, despite the amount of money the minister says is going into home care, the reality is it's not going into frontline services. I hear about that all the time from my constituents, where they're not able to get a personal support worker to come and help their parents in their home, or they can't get a nurse to come and take a look at a wound that they've had. There's significant issues with that. We've been very outspoken in the PC party about what we would like to do with respect to the CCACs and the LHINs.
Tell us.
We believe that they can be merged into a health hub that would be able to perform both services. We understand that there's the regional planning that needs to be done, as well as the specific service delivery in the community. There's no need for these positions to be separated. In fact, it impedes effective communication between the two levels. We believe it can be done eliminating a whole level of bureaucracy and putting more personal support workers and more nurses on the front lines in order into people's homes and providing the care they need.
If you reorganize the system that way, any idea how much money it would save on bureaucrat salaries, administration, et cetera?
It would be in the hundreds of millions of dollars. And we certainly know that
Christine,
the CEO's salaries have gone up by roughly 36% over the last 3 years under this Liberal government, while the salaries of personal support workers remain about $20,000. And we all know what an invaluable service they perform in our communities and in people's homes.
Go ahead, Minister.
Let me ask, so our budget, which neither of those two parties supported, included a $4 per hour raise for personal support workers who work in the home and community care sector. We did that because we know we need to attract more people to work in home care. We need to retain the PSWs that we have. I haven't seen either party come forward and say we would do the same thing.
No, but let's
need
just
those
hang on.
personal support workers.
But she wasn't talking about personal support workers. She was talking about the people who run the LHINs and the CCACs and their salaries going up double digits over the last 3 years. Is that in fact the case?
So we also, the legislature, before the legislature had dissolved because of lack of support from either parties, we had legislation tabled in the House that would cap salaries for the broader public sector, including people who work in CCACs. That legislation was before the House, and unfortunately, it had to die in the order paper. We will reintroduce that legislation because we think it is important to have a framework where broader public sector compensation is at a reasonable level.
Okay, let me get Franchelle now. I think that's your idea, your party's idea to cap salaries, is it not?
Oh, absolutely. We have been saying that CEO salaries should be capped at twice the salary of the premier. If the premier of this province can manage $132 billion budget for this province, I don't see why not. Hospital CEO and CCAC CEO and all the rest of them cannot manage their share of that budget within double the salary of the premier. I'll give them credit. The Liberals did double the investment into Community Care Access Centre, but so little of it trickled down because you see, way back with the Mike Harris, we had this competitive bidding where all of our not-for-profit home care providers, a lot of them went bankrupt, and a whole bunch of for-profit came in. The Liberals were opposed to for-profit, except that they've expanded it during the 10 years that they're there. So we have this system where the people who provide the care, the home care, are mainly PSW. They make pittance. They make barely above minimum wage. They sit by the phone to get a call. So the money was spent, but very little of it trickled to the front. And to answer the question of the budget, it is not credible. I have enough respect for the PSW that I know that work within the system to not give them false hope. Nobody believed it, including myself, and I'm not going to put false hope. Do the PSW needs to be better compensated for the hard work that they do? Absolutely, and the sooner the better. But right now we have within the CCAC the administrative part and the case coordinator have respectful wages with benefits, with a pension plan, and they are good jobs. But the people who provide the care, who go into your home day after day, they are not well paid, they have no benefit, they have no pension plan, and they're very poorly compensated for traveling from one house to the next.
Okay, let me get Teresa Pun on this. Hang on, let me get Teresa Pun on this, please. She hasn't said, I mean, for those who provide those services in the homes, they are now, a lot of that work has been contracted out, right? They work for private companies now as opposed to for a publicly owned organization. Has there been a diminution in the quality of the work that they do for those patients as a result of those services now being privately provided?
So there's an issue, right? Number one, we need the PSWs. The number two is we need them to have adequate training, and in order to entice people to receive that adequate training, to delay their paycheck coming to their home, we need to compensate them appropriately. Is an extra $4 enough? I'm not sure. It's a step in the right direction, but again, a lot of times you have high turnover in the PSW world, not only because of the poor pay, but because they're not adequately trained. They're not prepared for what they're going into home to home on a day-to-day basis.
So is the system worse now as a result of these services having been contracted out?
It's
You're not
hard
prepared to say that?
No, I'm not prepared to say yes or no. I think it's broken, and whether or not it's more broken or less broken, I think is just semantics.
Who is Madame Jalina? Is that you trying to get in out of town?
Yeah, I'm quite prepared to say that our system is broken, and I can tell you the example of Sudbury. The VON was our home care providers. They had good pay, good benefits. They had professional people who spend their entire career doing home care. Now we have a patchwork of agency that cannot recruit or retain a stable workforce. Quality of care is dependent on continuity of care, who's dependent on continuity of caregiver. When you have a different home care worker come to your house every week to give you your bath, well, grandpa doesn't want to strip naked in front of a different stranger every second day, so he doesn't want to have a bath anymore because they are forever having to deal with new people coming into their homes. Nobody likes this. It is disrespectful. Our system is broken. And why?
Okay, let me get a comment from Deb Matthews and then Christine Elliott. Minister?
So the budget that neither party supported contained significant improvements for personal support workers who work in that home.
It was non-believable.
Hang on.
It was in our budget. We know exactly how we're going to pay for it. It was in our budget that you wouldn't support. So we are committed to enhancing personal support workers, the quality of their workplace. We're going to start by paying them a decent amount. We're also going to invest in that training so that personal support workers take their rightful place as full partners in healthcare. They know their patients better than anybody else. I'm just mystified that both my critics would say we have to do better, but then they won't commit to doing what we have committed to doing, and that is increasing personal support hourly pay by $4 an hour.
Okay, Christine Elliott's turn.
Well, first I would say that the budget that the minister is referring to wasn't really a budget. It was just a wish list of things that they would like to do. But nobody really believes it was ever going to happen. But I think as far as the home care is concerned, I don't think it has anything to do with whether it's for profit or non-for-profit. I think it's just a question that the demand has increased. We haven't resourced it appropriately. And we really need to have a more robust look at things rather than just saying we're going to pay personal support workers another $4 an hour. We really need to take a look at a health human resources strategy to take a look at the appropriate staffing levels in both home care as well as long-term care homes, because we know we're getting people who are increasingly complex in long-term care homes as well as in home care. So we need to make sure that people are going to be safe in their homes and they're going to get the resources that they need in order to stay well in their homes for as long as possible.
Okay,
Christine, you represent the party that's promising to fire 100,000 broader public sector workers. You cannot do that without cutting cutting the number of people who are working in healthcare and in home care. So, I mean, I don't think you can have it both ways. I don't think you can say we need to properly resource and then also say we need to fire 100,000 people. It doesn't add up.
Deb, we've been very clear in the fact that we are not touching anything with respect to home care. We're not going to fire any nurses or any other healthcare workers. So that is a completely wrong assertion on your part.
So you're telling me you're not going to fire dietitians, you're not going to fire nutritionists, you're not going to fire social workers, you're not going to fire any of those people who actually contribute to a healthier community? You know, you've said you protect nurses, you've said you'll protect doctors, but there are a whole lot more people who work in healthcare than just doctors and nurses.
We're not going to cut anything in healthcare. In fact, what we want to do is enhance home healthcare for all Ontarians, and that's what our platform speaks to.
Ashley, you want to come in on this?
Well, I think one of the things that I find really interesting listening to this exchange, because all three parties do have a very similar approach to the ethos of healthcare right now, and that we do need to focus more on community care, shift away from the costly side of institutional care, and, you know, facilitate people aging well and in place. And I think that's something I've heard all three of the parties at Queen's Park speak of, and I know it's evident in the Green Party platform as well. But where we're hearing these flashpoints are the role of the private sector in healthcare. I think that that's something that would be interesting to see more debate, and I would actually like to see all four of you discuss that very directly, but also the role of the bureaucracy and the administration and what that should take. And in the green room before we came out, one of the healthcare workers was saying, you know, there are all these moving parts in our healthcare system that were created 50 years ago, and now they still exist sort of just because. And it does seem to be that there are a lot of agencies, a lot of acronyms. If you're an average viewer watching this right now, you're probably asking, what's a CCAC? What's a PS, maybe even what's a PSW if you don't have an older loved one who has a personal support worker at home. So I think that for patients, there's a lot of acronyms, there's a lot of discussion about CEO salaries, but what they want to know is, you know, when I go to an emergency room, how long is my wait time?
Right.
And that is something that the Liberals can say have come down since they've taken over.
Well, how about, let me follow up on that. On this very day, this morning, Andrea Horvath, the leader of the NDP, made an announcement saying she was going to double the number of, I think, ER nurses and long-term care beds, and some announcements that would get those numbers down.
Yeah.
Do those sound reasonable to you?
I think a lot of them are great ideas. The costing they attached to it to me seemed a bit ludicrous. I think they said it was $205 million over the first couple years to do it, and one of the things they were proposing were 50 new 24-hour emergency walk-in clinics. There is no way you could build 50 new emergency care walk-in clinics in this province for $205 million over 2 years, let alone the 4 or 5 other promises that were attached to that.
Let me get Teresa and then France on that.
So one of the comments that drew my attention was the 50% decrease in waiting times at the Emerge that they promised. And I believe, to be specific, they were saying they would increase the number of nurse practitioners. What confuses me as a frontline worker is that when I worked in Emerge, and again, whether you're in surgery or you're in internal medicine, you go down to Emerge, you see your patients there, there's a limited number of spaces. So increasing the number even of ER doctors may not change the waiting times because a patient cannot be seen in the hallway. Sometimes if they're very urgent cases, we'll bring them behind that double door and we'll see them in the hallway. But again, there's a limited number of hallway spaces. And again, sometimes we do exhaust those as well. So just by increasing personnel, that does not equate to a decrease in waiting times. And I was also just confused about where that 50% came from.
France, maybe we could get you to comment, first of all, to give us the nuts and bolts on the policy as it was rolled out today. And then you've heard some potential criticism from Ashley here on whether the dollar figures attached are all that realistic. So over to you.
Sure, absolutely. So what the NDP looks at is that a 50% decrease in the wait time. You're absolutely right that when people look at our healthcare system, they look at how long they wait in there and they find it not acceptable. So a 50% decrease for us is to realize that the wait time in our emergency room is a problem in itself, but it's also a symptom of problems elsewhere, problems in the community. So our emergency room acts as a safety net of last resort. If your primary care provider is not available, that's your doctor or nurse practitioner, you need care and they are not accessible to you, you end up in the emergency room. We all end up in the emergency room when the care we needed is not accessible to us, and in order to address this problem, also the symptoms of the other problems, we have a multi-pronged. So the first one is to have nurse practitioner in our emergency room handle the non-urgent cases. We all know that in some emergency room, average is 50% of the people that go to ER are non-urgent. They're non-emergent. They could have been treated elsewhere if they had access.
How about the dollar figures attached to the policy, though?
Okay, let me finish. The 50 new, Ashley was referring to them as walk-in. They are absolutely not walk-in clinic. I have nothing good to say about walk-in clinic, and the NDP do not support this. They are family health clinic where people that would be located in areas of high needs, so that if an emergency room is particularly busy, then one of those new clinics will be there. But the clinics will be not only for emergent, it will really be for primary care, to make sure that you support this community so that they have access, so that you keep them well, rather than them getting sick and having to recourse to the emergency.
Okay, we're down to...
Our platform is completely costed inside and out. We are the NDP. We are the one who get looked at more than anybody else for our finances. I guarantee you our platform is well funded, and some of it will come later.
Okay, let me get, because I think we're less than 10 minutes to go here, and I may have found the one policy item on which all four mainline parties agree. I'm not sure, but Sheldon Osmond, our director, I don't know if I can ask you to do this on the fly here. Get the four partisans on the program right now in a four-shot on the screen, because there is a private clinic, privately owned, in downtown Toronto, that is trying to sell plasma for sale. They want to buy it and sell it in a kind of a private market system. And there was a bill that was going through the legislature, which hadn't yet been passed, but was on the verge of being passed. And then the House was dissolved, and of course, as all legislation does, it died. I would like to know if all four mainline parties agree that this ought to be prohibited in the province of Ontario. Deb Matthews?
Absolutely.
That's a yes from Deb Matthews. Christine Elliott?
Yes, with certain caveats.
Caveats being?
Being there are some producers of plasma who've come to us to say that they think the legislation needs to be tweaked a little bit, that it might have some unforeseen consequences that will have an adverse effect on our healthcare system if we do it with the legislation as drafted.
Frangelina?
We are opposed to paying for plasma.
Okay, that's categorical. Teresa Pun?
Definitely opposed.
Okay. Do I say, is that 4 out of 4, or is that sort of 3.75 out of 4?
There's still some questions that have not been answered, and what we were hoping was to have committee hearings on the bill before we left for the election. So I think that there are still some questions that remain unanswered, but generally speaking, of course, we would not be in favor of paying for plasma.
I am happy to check that one off my list relatively quickly. Let's move on. We have talked about inflation on this program in the past, but then there is something called healthcare inflation, which, as we know, is much bigger than regular inflation. And it has meant in years past, although not so much lately, but in years past, it has meant that while inflation in the rest of the economy is at 1 or 2%, inflation in the healthcare system is at 6, 7, 8, 9, whatever. Let's bring up this chart if we can, Sheldon. This is around number 10, the rising cost of healthcare. And you can see over the past 10 years, it really did explode for a while. But then latterly, the Liberals think they've got a pretty good handle on healthcare spending, and that it has got up about the rate of inflation in the rest of the economy. Deb Matthews, in your view, are we reading that chart right? And have you guys really bent the healthcare cost curve?
Absolutely. And we had to take some tough decisions. You might recall I had some conversations with pharmacists. We've been able to reduce the price of generic drugs by 50% and then some more. We've had to hold the line on physician compensation. We've reformed physiotherapy, so more people get access to the physiotherapy they need, and we're saving money on that. So all told, those three items alone account for at least $1 billion in savings per year. I want to say I was okay to take those fights on. It would have been nice to have had the support from the opposition. I didn't get that support, but my mantra is always, if it's better for patients and it's better value for money, then let's make it happen. And so, yes, we have been able to bring down, reduce the increase in healthcare spending, and at the same time, improve the quality of care that people are receiving. So I'm pretty proud of that.
Christine Elliott?
No, we certainly have not bent the cost curve sufficiently. The studies show that if we continue spending at the same rate we are now, by 2030 we'll be spending something like 80% of the budget on healthcare. So we need to have a serious conversation about this. We need to talk about what we need to do to make our healthcare system more productive.
Give us one idea.
The international studies show that we're not getting the best value for money out of our healthcare system. So one thing that we could do is establish, for example, centers of excellence for chronic diseases. We don't have that right now, and as a result, we're not instituting best practices, and we're not making sure that care is being delivered as efficiently as possible. The government had gone some steps in that direction, the previous Conservative government with Cancer Care Ontario. The government, the Liberal government, Cancer to Diabetes Registry, which cost $15 million to the taxpayer. But we need to collect that kind of information to make sure that we're delivering the best care at the best price.
Franchirina.
Well, when the Liberals were in power from 2003 till late in the 2000s, they invested a phenomenal amount of money in our healthcare system without making sure that we were getting result, that we were getting better care, that we were delivering to more people the care, services, and programs that they needed. So now we see a plateau, but it is artificial. It is still investing or holding back money without doing their primary mandate of oversight of the healthcare system. There are so many areas where we are not getting value for money, but yet they continue to invest. We could do a whole lot better in keeping people healthy, in having a strong and robust health promotion, disease prevention strategy. We don't even have a Ministry of Health Promotion anymore. What the healthcare providers were talking about at the beginning, the social determinants of health, to make sure that we keep people healthy. All of this has fallen off. Well,
okay, I'm going to jump in here for a second, though, Madame Jarina, because I think we don't have a Ministry of Health Promotion anymore, but if I understand it, your party wants to cut the number of ministries by a third, so I don't think we're going to get one under you either. Isn't that right?
We want a strong and robust health promotion strategy, and the NDP has been clear that this is something that we want. We haven't seen this coming from this government. They talk about it, but we've never seen it. It has never been implemented.
Okay, let me get Teresa Pun on bending the healthcare cost curve.
Perfect. So I just want to make two quick comments. One, when you saw the jump in the curve, a lot of that also has to do with new technology. For example, when a new procedure comes on board and it is amazing, what happens? People sign up, people get those procedures, and it costs money. As our population ages, as ER wait times shorten and more people get access to their emergency physician, that will cost money. So what we need to do is focus more on prevention, and the social determinants of health is the easiest way to do that.
Social determinants of health, meaning?
Meaning poverty. So one of the ideas would be to put forth a guaranteed annual income to replace all the different welfare and all the different little things little handouts that we
Can a province do that,
get.
or is that really a federal responsibility?
A province can absolutely do that.
Yeah.
And so the reason this is worth doing is because study after studies have shown that poor people are more likely to be obese, are more likely to have addictions, are more likely to be involved in crime.
And therefore cost our system a lot.
Exactly. And so you raise them out, you give them the money up front, so they can use that money to buy food, to pay for shelter, to pay for childcare. They will then mobilize themselves out of poverty, bringing with them successive generations, and so we will reap the benefits both morally and financially in the end.
I got less than a minute to go here, and I want to give it to Ashley Chinati, because you, having interviewed all of these people before and spent a lot of time watching healthcare at Queen's Park, are going to tell us which one of our guests today would make the best health minister going forward.
Well, I actually think they would all make great health ministers, and I told your producer this as well. No, I do. They all really know the file.
I've already got 4 politicians on the show. We don't need a 5th here. What is that?
And I'm meeting Teresa for the first time, but I'd said that to her as well, because whenever I go to any of these smart women at Queen's Park with a really in-the-weeds policy wonk, they can all give me a great answer. And I think that they all know the files, and I think they all have the same idea that we do need to prepare our system for that coming demographic. And they would take different paths there. They were with varying levels of involvement for the private sector, with varying levels of involvement for different agencies that exist, or whether there'd be mergers. But I do think the general sentiment among the three of them that we need to start shifting towards more community care and away from the costly institutional care is something that will continue regardless of who wins on June 12th.
And we give the journalist the last word on this edition of the agenda. I want to thank everybody for coming on the program today. Deb Matthews, Christine Elliott, Frangelina, Teresa Pun, and Ashley Chinati. And as I say to all the candidates all the time, good luck everybody out there on the hustings. And thanks for visiting us at TVO tonight.
Thank you.
Support Ontario's public television. Donate at tvo.org.